so as Ted mentioned, Genesis Care it is the largest global provider of radiation oncology. We have over 250 clinics globally, predominantly across Australia, the US, Spain, and the UK. And we own and operate those clinics, and we work in partnerships with governments as well. And as Ted mentioned, we work very closely with all the suppliers in the radiation oncology world, obviously Varian Elector being the most prominent in that space. We have also looked at what work we can do in more LMIC markets, and we'd had a partnership and a pilot in Southeast Asia that we looked at over the last couple of years during COVID, which probably wasn't the best time to be trying to enter into a new market with some meaningful challenges from a travel perspective. But what we have been able to do is really looking at what technology can do to optimize the overall workflow and bring more access. And in our own clinics now, we've spent a lot of time developing our own software, because what we've seen is a lot of what the vendors have been producing in the space hasn't necessarily been designed for what the clinics are looking for from a provider perspective. And essentially, with radiotherapy being such a technology and physicians being an important part, but the physicians are really helped by a large technical team, there's huge potential to be able to actually automate a lot of the workflows and the technical work that happens as part of radiation oncology. And I think, as Serbi mentioned earlier on the call, is that we do have this technology solution now that we've been able to deploy across half our clinics globally, and we're looking to roll it out across all of them, where essentially it's an automated and AI-driven prescribing tool that links into the existing medical records provided by the Varian Electors of the world, but it allows our physicians to access evidence-based protocols and then drives the whole workflow. So now in our planning, over 50% of our plans are now fully automated, which means that doctors either don't approve or don't have to make any modifications before approval, or very minor modifications. So the potential here in some of the markets that we've been talking about is quite significant, because it potentially means that we're able to really look at ways in which we can optimize the workforces to be able to upskill people and then use technology more. And it's something that we found that when we were in the Philippines, it was definitely a challenge in terms of finding the right infrastructure in these markets and being able to deploy into it. And we've spent time now rethinking that, and as we deploy into other markets, we think there's real opportunities in it. And essentially also building a vendor agnostic approach, where we work with all of the existing vendors in the market and think about it more from a provider perspective. So I think the big challenge for us when we go forward with these now is actually really looking at the reimbursement structures in a lot of these markets. And that's one of the big challenges that we found, is that it's, radiation oncology is a capital intensive medical practice, but it's not just the capital, it's, the ongoing support of the department that is, ensuring that you've got the physicians and all the staff trained, and that there's actually a payer reimbursement structure that incentivizes the providers to be able to actually be profitable in the long term. And the challenge, I think, particularly in a number of these markets, is that often they can get money for funding the initial capital, but it's the ongoing running of the departments that can be very expensive. And it's the servicing the equipment, it's training the staff, it's paying the doctors, and in a lot of markets the reimbursement is very low, and it makes it very difficult for providers. And I think particularly a lot of private companies end up focusing on a very small part of the market where there's copay from wealthy patients who can afford it, and you end up with a very large tail end of the market where the government's left to support. And as a result, as Serbi mentioned, you get a lot of markets where there's either no access available or very limited access, because it's very difficult for these departments to be able to sustain a long-term investment, given that the capital requirements and the investment cycle tends to be a 10 to 15 year investment cycle. So really, and thinking about what Gerhard said before around the challenge, I think, for private capital going into some of these markets is doing it on your own is difficult, and trying to find the right partners from a private and public perspective to be able to do it together to create long-term sustainable pay models where there is some level of support for funding around not just setting up programs, but sustaining them into the full investment cycle to make sure that obviously staff are upskilled to the level that they need to be at, but then they're maintained at that and more people are brought into the system to meet what will be an ongoing burden going forward.